Tuberculosis remains a major public health challenge in Nepal. As a country located in the World Health Organization's Southeast Asia region, Nepal carries a high burden of this infectious disease. TB affects thousands of people every year, impacting individuals, families, and communities. The presence of TB hinders Nepal's socio-economic development and poses a significant obstacle to achieving its health goals. Addressing TB is crucial for the well-being of the Nepalese population. TB is caused by the bacterium Mycobacterium tuberculosis. It is an airborne disease that spreads through the air when an infected person coughs or sneezes. Symptoms of TB can include persistent cough, fever, weight loss, and night sweats. If left untreated, TB can be fatal. Factors such as poverty, malnutrition, and limited access to healthcare contribute to the spread of TB in Nepal. These factors create an environment where the disease can thrive, particularly among vulnerable populations. Recognizing the urgent need to address tuberculosis, the government of Nepal established the Nepal National Tuberculosis Program in 1982. The NTP serves as the central body responsible for coordinating and implementing all TB control activities in the country. It operates under the guidance of the National Tuberculosis Center, which provides technical and programmatic support to ensure effective TB control strategies. The NTP plays a crucial role in reducing the burden of TB in Nepal. The NTP implements a comprehensive approach to TB control, encompassing prevention, diagnosis, treatment, and care. One of the key strategies employed by the NTP is the Directly Observed Treatment short course strategy recommended by the World Health Organization. DOTS involves providing TB patients with a standardized regimen of anti-TB drugs under the direct supervision of healthcare workers. This approach ensures patients take their medication correctly and completely, maximizing treatment success rates and minimizing the development of drug-resistant TB. Over the years, Nepal has made significant progress in its fight against tuberculosis. The NTP has successfully expanded its reach across the country, providing access to TB services even in remote areas. This expansion has been instrumental in improving case detection and treatment outcomes. As a result of these efforts, TB incidence and mortality rates have declined in recent years. However, despite this progress, challenges remain. Drug-resistant TB, particularly multi-drug-resistant TB, poses a significant threat to TB control efforts in Nepal. MDR-TB is a form of TB that is resistant to at least two of the most potent first-line anti-TB drugs. This resistance makes treatment more complex, requiring longer treatment durations and more toxic drugs. Addressing MDR-TB requires strengthening laboratory capacity for diagnosis, ensuring access to second-line TB drugs, and providing patients with social and financial support to adhere to the demanding treatment regimen. Nepal's efforts to combat tuberculosis are closely aligned with global and regional TB control strategies. These strategies, including the World Health Organization's End TB strategy, and the Sustainable Development Goals, provide a framework for countries to work towards ending the TB epidemic. Nepal actively participates in global and regional forums to share its experiences, learn from others, and advocate for increased resources and support for TB control. Continuous support and innovation are crucial for sustaining the gains made in TB control and addressing the remaining challenges. Investing in research and development for new TB diagnostics, drugs, and vaccines is essential to improve treatment outcomes, shorten treatment duration, and ultimately find a cure for TB. Strengthening health systems, improving surveillance, and addressing social determinants of health such as poverty and malnutrition are equally important to create a conducive environment for effective TB control.